Hello, this is a prepaid collect call from an inmate at the county jail. This call is subject to recording and monitoring. To accept charges, press 1. To refuse charges, press 2.
Well, hello, Lori. How are you? Good, good. Glad to hear it. And how goes the battle there in the jail? Oh, so you'll be transferred over to Washington Correction Center for Women. The wonderful spot. Yeah, yep. I've heard just about everything about that place. It's, of all the prisons in this state, that's the one that gives me the most problems. And things aren't getting any better. So I don't know what things are going to be like when you get there. I know there's a few people that's standing in the sidelines ready to go, and I really, as much as I want to say something good, I cannot. It's just, I think it's a very dangerous facility, and it's got bad management going on over there. And the best advice I could give you is just prepare. Do you have any serious medical conditions that they should be aware of over there? Okay, yeah, that could be a problem. So make sure you have a physician on the outside or somebody that you trust that could relay messages for you, because there's a good possibility that when you get to the prison and they do tests and stuff, they'll either lose it, misplace it to the point where they can't find it. And it's taken them a while to provide necessary documents. So if you get copies of stuff, that will definitely help as well. And your loved ones need to keep hounding them. Yes, yeah. I mean, I the impression I get from the prison is that they're not paying attention to detail. And that could be the kiss of death for you. I consider them murderers when they get people into the prison, conduct tests, find out something is wrong, and then just kind of ignore it. And then when the person gets worse along the years or months, and then something serious happens, how can you not say that this was their fault? So read up on it, ask people questions, get all the information you can about your condition. I do know you're supposed to get prime medical care. So if it's something that you need, now if you're wanting pain pills or medicinal marijuana, something like that, yeah, they'll be a little reluctant. But if you need ointments or you need bandages, coverings, braces, anything the doctor says is necessary for your healing process or for you to live a productive life, that's something you don't play around with. And they love to cut corners on that for some reason. It's very expensive on a daily basis to hold a person at that prison. And even though the prison is no longer maxed out, it still has very poor day to day
You have 60 seconds remaining.
care. So I, I'm really concerned about that. And I'll keep an eye out myself. And if you want me to, I'll talk with your loved ones out here. Oh, yeah, your mother. Yeah, she's definitely a good person to have in your corner. She knows you pretty much as well as you know yourself. Ah, good, good. Like I said, having a family physician or somebody here on the outside who knows the medical and nurses,
You have 30 seconds remaining.
yeah, that definitely will help too. So keep in contact with them and have her do that right away. And once you get there, talk to the medical staff. Let them know you're concerned about the way people are treated over there. And they're most likely to step out of this little loyalty that the Department of Corrections has. So they may be able to help you out in more ways than you can imagine.
Thank you for using Inmate Call. Goodbye.
Hello, welcome to AQS Inmate Call, and I'm your host, Joel Wilborn. Now, in this episode, I just want to emphasize that one of the reasons I became a prison advocate is for the safety and security of the people that are in there. I'm not a big proponent of giving them color TVs, collection of CDs, or My Pillow sheets and bedding. I want to make sure that the people who go in there either come out in the same condition as when they went in or in better condition. They should not come out worse. And I understand that could happen in cases, if somebody gets an infection and then it starts to spread and they're working on it, but they can't stop the spreading. At least make sure that it's caught in time. So if the person goes in there and it's already spread too far and there's not much you can do, that needs to be noted. But if the person goes in there and there's a chance it could spread and get worse, catch it early, especially cancer. Cancer must be caught as soon as possible. There's no playing around with that. And the person who's running Washington Correction Center for Women, which is, I think, is the most unsafe prison in the state, when she was the head of security, she would not give me the name of people who refused to talk to me. She said there were women in the prison that didn't want to talk to me. I asked, well, who are these people? And she just stopped, refused to talk. That's a security issue. If I reach out to somebody who doesn't want to talk to me, that could cause stress. That could cause trauma. That could cause legal issues. It's easier just to prevent it. And I'm not sure why a prison wouldn't want to prevent things escalating. What is it about continuing to do something that's wrong? Now, I do have a story on my website, AmericanQuitInSociety.org, and on my YouTube channel that shows Paula's story. Now, she was awarded $9.9 million because they were incompetent. She went in with all the red flags of getting diagnosed with cancer, and they failed to perform proper tests. At the time she went in, the prison was pretty crowded. So they would send folks to Yakima, Washington, in their county jail to alleviate the overcrowding. When she went in, she did show signs that this condition could escalate. And so rather than keep her there and keep monitoring her, they sent her for the overflow. There was no reason to do that for somebody in that condition. Now, there are people, she was in her 40s. There's people in their 20s and 30s, and they're not showing any signs of any health issues. It's easier to send them over there. And Yakima is a terrible place to go. They are just, I'm beginning to think they weren't equipped to handle these people coming from the prisons. From what I understand, they're not doing that now because the prison isn't overcrowded. But you would think that after losing $9.9 million and after this person was diagnosed with terminal cancer and doesn't really have a chance of living a long, healthy life now because of their neglect, you would think they would be a little more caring and they would be a little more detailed about stuff. And so I'm hearing from other folks in the prison, and I'm getting referrals, and there's still people in there that have terrible medical conditions. Some of them have just given up. Others are saying, no, I don't want this to get bad, and I don't trust these people, and that's good. So I have to do my work on the outside. And I'm working with Cindy Rhodes, and her story is on the YouTube channel and on podcast. She is being tested for cancer. There's a possibility she could have cancer. I don't know what type. I don't know if it was a result of their negligence, but I do know that her husband and her, as well as myself, we keep this up so that nobody will forget about her. And the governor of the state of Washington and the Washington Department of Corrections came down to the prison, the women's prison, and discovered that medical records were being delayed. They weren't being presented to the physicians and the medical team in a timely manner, and that they were still neglecting the medical needs of the people that are housed in this prison. I'm thinking the officials at WCCW are just saying it's easier to pay out millions of dollars to a person than to correct the conditions. Other prisons across the country can do this, but not this one. And it's a crying shame. But I can't let this go. Now, when Paula told me she had cervical cancer, I immediately started doing some research on it and found out that HPV is a sexually transmitted disease, and it's a big contributor to this type of cancer. And of course, later on, after she started going through diagnosis and treatment and stuff, she told me, "Oh yeah, by the way, I have HPV." I kind of figured that out, I told her, but that's something that she knew about, and that's her private business. That she can tell me whether or not she wants to. But the officials at the prison knew that, and there was a nurse in there who said a lot of the inmates at WCCW have venereal diseases, and it's very rare that somebody doesn't have one. And HPV, if 2%, 3%, 9% have it, they should not be moved to an overflow facility. They should be watched. And if anything, if they're not a violent criminal, I know in 2020, a lot of folks were let out because of the COVID. Paula should have been one of them. They should have said, we've got a lot of people housed in here. The COVID is rampant. Get her out so she can get care on the outside. But no, they kept her in there as if she's some serious violent offender. And talking to the prosecuting attorney, or at least I was ignored by him, but trying to reach out to him, they just did not like her. And they didn't think that she deserved a break. Even on her deathbed, they don't think she deserves a break. People are not property, and people deserve respect. Now you could think of folks like Jeffrey Dahmer, Ted Bundy, and say these guys don't deserve to be amongst the living. They're both gone, and not too many people are shedding tears because of it. But if we're going to lock them up, they have a right, no matter what crime they committed, to proper medical attention. And what makes us as taxpayers paying all this money out to compensate for their lack of procedure? What makes us different from these folks that we are neglecting? If a person is a serial killer, goes in there and picks up cancer and then dies, in my book, that's murder. And if we're paying that person's family $25 million, why? What's the purpose in that? Isn't it easier to invest money into the prison and keep people healthy? I mean, we're in the state of Washington, all the prisons together, their expenditures are about close to $1 billion. Now imagine that every year paying $1 billion and then paying settlements, and nothing changes. So I'm hoping to keep an eye out on Cindy Rhodes. I don't want her to get cancer. She keeps telling me this might be the last time I talk to you. I don't think I have much time on this planet. I don't like hearing that stuff. And she, as far as I can tell by communicating to her, is not a guilty person. And you can listen to her story, and she loves to get it out there, and just follow her. This is a great opportunity to start from the beginning. She has constantly complained or even threatened her if you keep complaining. Now, I don't want to speculate on why they're saying stop complaining, but I will say that if she doesn't say anything, it will get worse. You got to talk. You got to get things out. And she's sending out emails, and she's doing voice messages to let folks know what's going on with her. And if you really want to see how the system works, just follow her, and I can give you updates when I get them. She's going to be tested for cancer. We got the team to go down there and take a look at the place and say, yes, it's bad here at this prison. They're not taking care of people like they should be. And I'll tell the justice system, if you cannot take care of these people, don't send them to prison. And even a person on death row deserves to have a spider bite treated or a broken toe. You don't just sit there and say, well, we don't have the staff. Here's an aspirin, and that's that. I've got two people that are contacting me about getting attorneys. They've just gotten to the point where they have no confidence in the medical staff, that they just want to go straight to the attorney. And helping Paula get an attorney, it shouldn't have been an option. It shouldn't have been something we needed to look at. But I'm glad we did. I just don't know what $9.9 million is going to do for her personally. I don't know what it's going to do for anybody. But I do know that if we just ignore this, it won't stop. They've proven that time and time again. She was awarded a settlement in 2023, and it's still a very bad place for medical treatment. I would love to see that place closed down. I'd like to see the people get out for alternative treatment. They ended the contract with Tacoma Community College, which was giving people good education. They want to get their GEDs in there. They want to learn a skill. They want to get out and they want to be productive. And I hound that. I constantly tell them, what do you want to do when you get out? What are your goals? And those who do get out and use and rely on those resources, like Marianne Atkins, she got a degree she got training in cosmetology and got her diploma, so she can get out and work in cosmetology. And I've got some people in the men's prison who want to do the GED, and might as well take advantage of it. You're sitting in there, take advantage of the education, and then get out and give back to society. When people come out of prison and they starting their own businesses, or they're starting to give advice at schools and community centers, and they're paying taxes and giving back, that proves that these correctional centers are working. And that's what we want. Don't condemn people for trying. And there are those, I admit, that just don't care. They pretty much get in there and it's like, if I get out, I'll come back. I mean, the drug trade in there is amazing in WCCW. And when they get out, they're telling me how this system works. And it's a shame that the DOC won't listen to me, but there are people who do. I know the state law enforcement, the state troopers, they'll listen to me. And we can get things done, but there's arrests and there's lawsuits, and it's just, there are better ways to do this. We need to work together as a community instead of fighting, instead of hiding. To tell people, don't put out in public that we don't have a contract for higher education. Why? Don't tell people that you're having medical issues in here. Don't complain about it. That's how it works within this little good old boy system in the DOC. They all work together and hide things. But there's medical people. If there's somebody that's listening, they'll talk. And I'm glad I've got nurses out there that will relay information that's important. Because these people, they care. They didn't get into the medical profession to hide things or to lose records. They got in there to help people. And and for some people, you can give them $2 million. It won't give them the joy that saving a life would, or changing a flawed system, improving it, getting it to work better. These things give people a reason to get up in the morning. They give them hope. It brings joy to them. And then to have a person stand up and give you a big hug. Thank you. You saved my life. And if one person's going to die, let's not make that a worthless life. Maybe the information that we gather from all of this can help somebody else. One life is worth it. We don't have to save 10, 20, 30 people. Be nice. But if we save one, yeah, all the money, all the effort, all the time, all the hardship is worth one life. And $9.9 million, even though the DOC says, yeah, your life is worth $9.9 million, we're giving you this, shut up, live the rest of your life as enjoyable as you possibly can, we're done with you. No, human life is worth more than that. And it doesn't need to be covered up from now until eternity. Let's put an end to that. Let's stop this nonsense. There are people in prison who are innocent. Some of the people I've been working with, they're getting the Innocence Project to work with them. That shows that they found something that's just not right and need to investigate. There's a few people. Greg Brown says he was locked away and there was no way he could be guilty, but nobody wants to listen to him. So we're going to get his word out. And hopefully you'll listen to it and talk to people about it. Maybe you know somebody that's in a situation like that. But they'll continue to do this if we don't keep an eye on them. And I think this is the best way to do it. Hopefully, when people call, they'll listen, but I don't really count on it. I think there are legislators, there are community leaders, and there are other advocates out there who like to hear this stuff and can actually do something to put an end to it, because the DOC certainly isn't. After all of this, WCCW is still neglecting the health and well-being of the people that's locked up in there. What a shame. Well, thanks for tuning in. Go out and have yourself a spectacular day and make stellar memories for tomorrow.